to Sept Environment Health. It's Dr. Rachel Northern here at Johnsburg Chiropractic Wellness Center in Johnsburg. I have Dr. Kristi Banham again with me today, my favorite physical therapist. And so tonight we're talking about just chiropractic and physical therapy, you know, how to protect your health and kind of what we're both about. So first off, I always want to start with the definition of health. What is health? What is it to be healthy? And, you know, is it feeling good? Is being medication free? Unfortunately, anybody you walk up to, or most patients, when I ask this question, they're like, well, feeling good. But that's not a complete answer, because unfortunately a lot of people feel good before they're diagnosed with, or had a heart attack, or diagnosed with cancer, or diabetes. Those are silent, call a lot of times silent killers. So we want to make sure that you're healthy, and what we do is try to evaluate you on that. So, you know, do you think living without pain is healthy? Do you think just not taking any medications is healthy? Do you think being flexible is healthy? You know, do you just think, like I do, like being optimal function is healthy? You know, have vitality. My goal is to try to live another, 40 years from now and still be pretty vibrant and active in my life. So, what is the definition of health? If you looked it up. So, my favorite definition of health is defined as physical, mental, social, and spiritual well-being, not just the absence of disease. So that's pretty much all-encompassing. Today, mostly we're going to talk about physical health, but all those other aspects do influence your, way you function and your health and your physical body. So, a little funny quote I have, and I love from Thomas Edison, is the doctor of the future will not give medicine, but will interest his patients with the cure of the human frame and the cause and prevention of disease. So I really like this quote because it's talking about like the preventative, the health, like focusing on what's important, not just treating a disease. It's actually treating the patient. Because unfortunately nowadays, what we have is this. This is our crisis. We are in crisis care. Healthcare in our country. So unfortunately, it's like once a week I have a patient come in and say, I can't get into my doctor for 2 weeks, 3 weeks, 3 months, 6 months is the longest I've heard. And they were actually wanting to do preventive care. They want to get their blood work done. They want to check and see how they were doing. And unfortunately, the doctors are so overloaded with so many people sick in crisis that we don't have room on the schedule just for people to do preventive care. Fortunately for me and Kristi, we do have some room in our schedule to see people sooner to help with this type of care. So, but mostly we want to help prevent them to go into crisis. So, what is chiropractic? So, I will just read this one statement. Chiropractic is a form of treatment that restores the spine into proper and natural body alignment, which reduces tension on the nervous system. The chiropractic adjustment can be done by hand or with an instrument like I do. These adjustments allow the body's innate ability to heal itself. So mostly what I do, what I love what I do is I'm not adding to the body, taking away from the body. I'm really restoring the body and letting the body heal itself. It's kind of awesome because there's no side effects with that. Also what Kristi does, she's working with the body. She's restoring proper muscle balance. So I like to tell people I'm a functional neurologist, and I'll show you on the next screen why. Because this is the chiropractic, the spinal nervous system. So most people think about, when they think about the nervous system, they just think about the brain. They think maybe of numbness, but they never think about how your C2 controls your sinuses. So sometimes when I have people with allergies, C2, I adjust their C2, their allergies improve. Or if I adjust their mid-back, their acid reflux will improve. So it's not just back pain we're about, it's about the whole nervous system functioning optimally. So I have a lot of patients come in and ask, how did I get here? Like, what's wrong with it? What's my problem? Why does this keep happening? And what caused, my problem? And a lot of times I would say, let me ask Alexa, what did they do? Because I used to say, I don't have a magic ball to look into your history of how you did this. All I can do is see what is going on with you and then reverse engineer and try to restore you back as best as we can. But in chiropractic college, I was taught the 3 T's that cause, we call subluxation or distortion in the body. And then later on I learned about 4 T's. So the first T is trauma, and whether that be physical, whether big, like you were in a car accident or fell out of a tree and broke your arm, or little micro traumas like improper posture and things that you do on a daily basis. Right now we have a lot of kids that are getting repetitive traumas from doing certain sports all year round in the same sport and not getting, proper balance on their muscles with that. So I have some questions on that. So with that, thank you, Kristi. And so that, so here's some questions that kind of help with that. Are you exercising frequently? Are you making sure you're trying to activate all your muscles to help your body frame? Are you, having proper posture and proper ergonomics at your workstation or your desk? Do you have poor muscle tone or muscle balance, or at an appointment I'll have one person stand on one leg and stand on the other leg, and a lot of times they're stronger on one leg versus the other, and I go, okay, that should be right. So what's throwing up? So also as we get older, we have a decrease in our bone density, and so that's important to make sure we address that part as well. So that's one aspect. The other one is thoughts, psychological stress and triggers. So here's some questions on that part. Do you struggle with falling asleep, staying asleep, not sleeping consistently? Do you have depression, mood swings? Do you have your shoulders tight and you're stressed and anxious all the time, or fatigued? Do you have a support system? Do you have a family that you feel like you're supported to so you can relax and share your burdens with others? And that's some of the mental triggers there. Toxins is another one, which next month I will be talking about detox again. Spring and fall, it's that coming up. And I go into that, or you can go on my videos that I have talking more detail about those things that trigger distortions in our body. And then time. Unfortunately, I cannot turn back the clock. I cannot reverse degeneration. We are born, we age, we decay over the time, and that's going to be how it's going to be. I have some patients coming in wishing I could just reverse some of the things that are happening to them, but all I can do is help them be more quality of life and help restore some balance there. But if you've lifted 50 pounds weights in your 20s, are not necessarily going to be able to do that in your 60s or 70s. I a lot of times have patients hurting themselves because they're trying to maintain the same weights they did before. So it's like, no, your muscles are different. You need to dial it back. Keep doing the weights, but not like you did before. So, and that's what I got there. And let's see the next slide. So one thing about statistics, this was just talking about like 70 million, I think it was. Yeah, 70 million adults in the United States deal with chronic pain. Low back pain is one of the number one problems in the United States, or second most reason why they see a doctor. And chiropractic adjustments research has shown that we can reduce or eliminate 75% of low back pain cases. So that right there, unfortunately, if they go to the ER, they're going to get a muscle relaxer, a pain reliever, and unfortunately not referred to us a lot of times. They still don't understand how we can help with that, even though the research is out there. So we could eliminate a lot of these drug problems if we could get people proper care, because we do have a good success rate with particularly low back pain. Other benefits of chiropractic are I help a lot of people with neck and headaches, improving posture. Those people that like to be nice and tall, we have improvement on posture pictures. We take one in the first exam and later on. Of course, improving range of motions, which then reduce some of the pains when taking stairs or doing different activities. I did have an 80-something-year-old patient like 2 weeks ago. Oh my gosh, she started with low back pain like a month ago, and her low back pain went away right away. And then she realized she could move her knee, which she hadn't moved in like 20 years again. And she was like, I'm not doing anything different with seeing you. So that was awesome to hear in the office here. But no, not guaranteed, but it was pretty awesome. And then just chronic, conditions like I was just saying. And also cute stuff. So whiplash. I just had another teenager that's a little bit more extensive that you need a physical therapy to work with to make sure. But mine are little whiplash and stuff, but there's a lot of chiropractors that love working with those acute injury problems. Okay, and now I'm handing it over to you.
So for physical therapy, we're kind of the movement specialists and the musculoskeletal specialists.
I'll do this for you.
Thanks. Although we deal more with like exercise, patient education, and some hands-on work, more like soft tissue mobilization. Some PTs will do some joint mobs. It really depends on the PT you see. And we work in all different settings. We also kind of take a look at the whole body. So when you come in for your first evaluation, we kind of assess how your balance is, how you're walking, how you're moving, what you do for a living, or what you like to do recreationally. And there's PTs that treat infants all the way up to PTs that treat end of life, or the hopefully the geriatric population. So we physical therapists really like to help sometimes in those acute situations, such as like the car accident. Ideally, we like to help people reach those fitness goals, like I want to be able to play softball without pain. I want to be able to do some lifting without pain. I want to be able to vacuum my house. Those kind of things. We improve their independence and help them lead active lives. So physical therapy, when you go to PT school, you get a doctorate degree, and you kind of learn every kind of setting. And then when you graduate, you can either do a residency, a fellowship, take continuing education classes, and that's where you're really going to get into like the nitty gritty. Like if you came to me for wound care or for dizziness, I would be completely lost. But I like to treat the pelvic floor and orthopedic injuries. For the last 6 years, I've been treating kids in a school-based setting. So we kind of work all over the place, which is pretty fun for my profession. So some tips to get the most out of your PT. I want you to like work with the PT. If your PT and you don't meld, like mesh really well, you can always ask for to be on someone else's schedule, or go look for a different therapist. We don't, there's not a one person fits all. Take an active role. So this isn't a passive thing. You don't just lay there and get a massage and go home and are cured. You have to tell the PT what you want. You have to tell the PT if it hurts, if you don't feel a stretch, if you are confused, and then ask questions. You know, if I'm having you do some weird shoulder exercises for your neck and you don't understand why, ask me. Or like my grandpa was doing PT for his leg pain, but it was because of his back that he was getting this leg pain. So he was mad that the PT was treating his back. So the PT didn't explain it to him. You need to speak up during your sessions. If something is bothering you, if you don't feel it, you gotta let the PT know. We can't read your mind. And follow that therapist's guidance, and the doctor's guidance. If you had shoulder surgery and you're supposed to be in a sling, I don't want you to tell me that you were lifting your grandkids when you're only like 2 weeks out of surgery. That's something that can re-injure your shoulder, and those are things that the PTs know. Also, you need to do your homework. If you're not doing your home exercises that once a week that you're with the PT, and you only do exercises once a week, it's not going to help. Same like if I'm going to quit smoking, but I'm only going to quit smoking for 1 day a week, well, that's not giving the same benefits as if you do your exercises regularly, and that depends on what the therapist wants you to do. And sometimes it's a lifelong thing. You know, I brush my teeth every day to make sure they stay healthy. I do certain exercises for my hip, my core, 3 days a week to make sure that it's healthy. So a lot of times people say, like the old thought is that I need to go to the doctor to get a script for the physical therapist. I want to let you know, in Illinois, where we are, we have direct access, and we've had direct access since 2018. Every setting is a little different, and just because we have direct access doesn't mean that your insurance company will pay for it. So it's something that you need to look into. But about 80% of people can get physical therapy covered without a script. So you don't need to see the doctor first. You don't have to pay that $40 copay to see the medical doctor before you come see us. You can schedule usually a free injury screen if you don't know if physical therapy is right for you or not.
Okay, well, the question for that
Oh, yeah.
is, well, one question is, how does somebody know, okay, because you said free access.
Mm-hmm.
So for me,
Direct access.
Sorry. I meant like they don't need to
Right,
free
right.
the doctor's script is what I meant to say. So direct access to physical therapy. So for me, like with patients, a lot of times, I restore the joint, the pain goes away. Usually I send patients to you when it's been like, okay, it's been a couple weeks, we're not getting any changes, then I'm recommending them to see a physical therapist, so at home, who is somebody like, when should they think, oh, maybe I should try to go into a physical therapist?
So there's different times. So, like if you roll your ankle and you're like, I don't know, did I roll my ankle? Did I sprain my ankle? Did I break my ankle? If you're able to walk and put some weight on it, you want to see the physical therapist. Sometimes we can just be like, yeah, it's just a sprain, you don't need it. Same with the shoulder, or something like that. My shoulder's been aching, and we kind of look at it. Maybe we think you do have a tear in your rotator cuff, and we refer you to the surgeon. But more than likely, it's something like bursitis, tendonitis, something like that. And then we can work those muscle imbalances to help with the alignment and decrease some of that pain. We also have different modalities that can help, like kinesio tape, dry needling, ultrasound, stuff like that. Did that answer that question?
Yes.
Okay.
Okay, and so, well, that was it's another thing is I get a lot of questions going, well, how does physical therapy help like bursitis? Like, it's the inflammation of the tendon or the bursa or tendonitis. So what helps?
Yeah, so we don't prescribe medications. We're non-invasive, just like chiropractors. And we can help move the joint so that it has better alignment by doing muscle, by doing certain exercises. So, we might test, like, is this muscle a lot weaker? Is this muscle a lot tighter? And then we'd give you different stretches, different exercises to help with that. And then we also do soft tissue mobilization and joint mobs to help improve the alignment for that. So once the alignment is better, then there's less stress on the bursa or the joint, and then you have less pain.
Right. So for me, like I personally, Kristi's helped me twice personally with the shoulder pain, like repetitive injury. I got adjusted, I got massage after a couple months, and it's amazing how she gave me some simple little tiny easy exercises, and within like a week I'm like, oh my gosh, I feel better when doing my exercises. Now again, I'll admit, I know I should do these exercises more often. So exercise in general, this is a kind of question that's like lots of different research on there. So like what the recent research for you that you think of is how often should someone exercise?
So usually if I'm treating you for, say you come to me for, well here's one that you might not even know I can treat. Say you come to me for urinary incontinence. I might tell you to do these exercises, maybe start out twice a day for 3 weeks. And then I'm going to have you drop down to once a day once you're starting to see improvements. And then if you're seeing improvements at once a day, maybe a few months down the road, I'll drop down to like 4 times a week. So some of these exercises, though, like I said, you're going to have to do forever. So usually I tell people they need to do their exercises most days of the week, which I would like you to do them like 3 to 5 days a week.
Thank you. All right, so kind of wrapping this up here. The slide I had before this, like, what's your investment. Like who's responsible for your health? We had that screen up there. So who do you think is responsible for it? A lot of people like, well, my wife, she's the one that feeds me, or makes me do things. Your family, is your family responsible for your health? Is your health insurance responsible for your health? So a lot of people go, well, for example, I'm not in network with most insurance companies, and they'll say, well, I'm not going to come to you because my insurance company doesn't cover your services. Are they responsible? Are you going to let them dictate what your health is, your vitality is? Is your doctor responsible for your health? So I'll even say myself, even if you come to me, your ownership of your health is yours. It's your responsibility to take care of yourself. So doing some of the things, being proactive with your body is very important. I'm going to end you a little bit with this fun quote, which I was up there already. Mark Twain, the only way to keep your health is to eat what you don't want, drink what you don't like, and do what you'd rather not. So physical therapy, I know a lot of patients say, I don't want to do it, I don't want to do it, but it's what's best for us. So with that being said, I'm Dr. Rachel Northern. If you want any more further information from me, you can always go on our website, thedoctorandyou.com, all spelled out. I did write a book, The Journey to Vibrant Health. It covers a lot of these health topics that we talk about. It is on Amazon, and these videos, I have lots of videos on YouTube. So it's Rachel DC and then CACCP, because I'm a pediatric and pregnancy certification. And then we have a slide from Miss Kristi. So how can people get a hold of you if they need to?
So I'm here once a month to treat patients that need it. And I work full-time for the schools, and then I also work at an outpatient clinic. So if you need some physical therapy, hit me up. You can just call Dr. Rachel's office and set up an appointment, or they can give you a referral to one of the outpatient clinics I work at.